Hey, Jill.
Hi, Jen.
Today I want to discuss the Davison et al. Article, Job-Related Problems Prior to Nurse Suicide, 2003 through 2017, a mixed methods analysis using natural language processing and thematic analysis. This study looked at 203 nursing deaths between 2003 and 2017. Now, we've previously discussed that registered nurses are a higher risk for suicide than the general population. So this article really dives into some of those issues that may be related to these suicides. The purpose of the article was to provide context to job-related problems experienced before nurses' death by suicide. They wanted to use this information to identify future suicide prevention strategies, which really is something we can look at as nursing professional development practitioners and what we can do to help in the fight against suicide. They came up with a theme for a timeline to suicide, and it starts with chronic struggles like previous suicide attempts, substance abuse, chronic pain, or conflict at work. Then there's peri-job loss or imminent loss of your job. And then that progressed to being trapped in a crisis when you're feeling despair as a result of the things that are happening to you in your life. And then it advances into feeling like there's no way out to finally finding a way out, which means you actually have a means to commit the act of suicide. Nearly all of the nurses in this article who had committed suicide were either out of work or in the process of losing their jobs. And that gives us a framework to look at as far as things that we can do to help identify issues that people may be having prior to suicidal thoughts or committing suicide.
Gosh, Jen, this article highlighted some very interesting narratives, and I'd like to highlight one that was included in the article, specifically in the finding a way out phase. Again, this is a nurse who hits rock bottom and has access to a means if available. And as nurses, we not only have the knowledge, but we have access to accomplish death by pharmacologic reasoning. So this narrative reads, the victim's wife discovered the victim lying in his bed with an IV in him. The victim also had a suicide note stating he had finally found peace. The victim had left letters to his children and notes in his diary about planning his death. He mentioned that he had a way to do it right this time. He also emailed his employer and a coworker indicating that he had committed suicide. He was well liked and respected at his job.
That's tough.
Wow. So how could this have been prevented? What proactive measures can be taken to reduce the stigma associated with mental illness and even substance use disorder? So this article notes that timely treatment for mental illness is crucial, and the study calls for alternative to discipline programs for nurses to be improved and standardized. Did you know that currently only 39 states have alternative to discipline programs working with the state's Board of Nursing?
Wow.
In fact, it's been found that nurses who remain employed were more successful in their alternative to discipline program. So at the end of the day, what are the NPD implications of these findings? Specifically, the article did call out educators playing a role in preparing nurses to recognize this and to seek treatment for individual mental health issues and risk of substance use. We can advocate as NPD practitioners for organizational change and support for our nursing colleagues. We truly directly contribute towards healthy work environments.
I think that awareness is really the number one thing that we can help with as NPD practitioners, and making people aware of the signs and helping them to understand that mental health issues are common, especially in our line of work, and trying to erase that stigma that surrounds mental health issues and to be really supportive of the other healthcare professionals that we work with. This was a very powerful article that I would recommend to everyone watching, that you do a deeper dive into the article and think about ways that you can implement suggestions to help support those who are at high risk for suicide.